Right, I guess we're live now. So good afternoon, everyone. My name is Matthias Andersen. I'm the managing director of Archinova, an NGO from Germany that's based in Dresden. And I'll lead you through this panel discussion today on the topic of access to clean water and also the cross-cutting issues to health. Right. So access to water is, one of the fundamental needs that we all have, and for the last 11 years, it has also been deemed a basic human right. So, along with sanitation and some other things. So this is one of the key elements that a lot of agencies are focusing on in the humanitarian relief efforts around the world. Now, one of the things that sort of is making our job a lot more difficult is climate change, because this is a global issue that doesn't manifest itself in the same way all throughout the different regions of the world. So in some regions, especially vulnerable communities, have experienced issues or the symptoms of climate change for a very long time, and things are not getting better. So today we've got the opportunity to focus a little bit on the Horn of Africa region. And I've got some esteemed colleagues here with me today from two local organizations from Kenya and Ethiopia, as well as a colleague from an international organization that's also working in Ethiopia. So maybe we can start by giving the panel members an opportunity to quickly introduce themselves. And I don't know, Amina, would you like to start? Just give us your name, your position, the organization, and tell us where you work. Amina, I'm sorry, your microphone is muted.
Sorry. My name is Amina Isako. I work with a non-governmental organization based in Kenya, Marsabit County, as a WASH program manager.
Wonderful. Welcome to the panel. Next, Mahmoud, would you like to introduce yourself, please?
Okay, thank you very much. Allow me to introduce you. My name is Mahmoud Ahmed. I'm working an ODA national NGO based in Ethiopia, and with my position is Health and Nutrition Program Coordinator.
Thank you very much, Mahmoud. Can you maybe, ODA is an acronym, can you say what that stands for, please? Just so the audience knows. The name of the organization, ODA.
Organization for Welfare and Development in Action.
Great. All right. Thank you very much, Mahmoud. George, go ahead.
Hello, everyone. My name is George Kijana. I am the country representative. I work with Medicine du Monde in Ethiopia.
Right. And so Medicine du Monde is the French name for Doctors of the World, I guess, internationally. So
yes, correct.
Right. Thank you. And we're also very lucky that this session is live translated into French for our colleagues in the Francophone regions of the world. So a big thank you to whoever's doing the translation. I know that's quite difficult. We'll try to speak clearly and make your job a little bit easier, but I do understand that's quite difficult, so well done on that in advance. Right. So in this panel, we would like to sort of focus, take a really close look at two regions in Ethiopia and in Kenya, and see sort of the impacts of what access or the lack of access to water means to the work there, and then also again put that into context on sort of a slightly more regional and global level. And I think that's why this panel was selected in this configuration. I'm really, really happy that we managed to get all of you here to speak on those topics today. Maybe we can just dive straight in and get each of you to share a little bit of the experiences that you have in your particular areas, and what sort of the WASH programming and all of the cross-cutting issues that go with it have meant for your work there. maybe we can start again with Amina, if that's okay. If you can, because I'm not sure that all of the people watching this are familiar with your region in Kenya. If you can just give us a really quick or description of the area that you work in and the types of communities that you deal with, and then go into the social impact aspects of the work that you do as well, please.
Yeah, thank you. Marsabit County, an area where we are working as an organization, is a water scarcity area. And the main source of water is borehole, and there are few boreholes, and the quality of that borehole is highly saline. But since the community, they don't have option, they use that water, and it has really affected their health. And in some areas, the groundwater is not available, and the community rely on rain-fed structures like water pan, underground tank, and rainwater harvesting tank. And once these water points have exhausted after the rain, the community have to walk for long distances between 20 to 30 kilometers in search of precious commodity, wasting a lot of their productive time looking for water, queuing for water at the water point because of the huge population of both human and livestock at the water point. And in this area, in the pastoral community setup, women and girls are charged with responsibility of collecting water. So even girls who are in school, they miss classes, they perform poorly, and finally they drop out. And that results to early marriages because in pastoral community setup, valuation of girl education is very low. But with the enrollment campaign, with campaign to the community to be able to take their children to the school, they have been able to take some few girls to the school. But because of the challenges of access to safe water, some of the girls still drop out. And then there is issue of challenges with the water quality, and the community, because they don't have option, they still use that water from the bowl, which is highly saline, and some parameters above, way above WHO standard, and also the water from rainwater facilities, which is highly contaminated because it's a service run of water, because that structures harvest service run of water and resulting to affecting their health.
Thank you very much, Amina. Yes, I think salinity levels in water are one of the things that are quite difficult to get out in water treatment as well, because this is something that you can't really get out mechanically very easily. There are different processes of doing it, but they're quite cost intensive and energy intensive as well. So I think that is a huge issue that you have there. Now, Mahmoud, in the Somali region of Ethiopia, I think that there are a couple of things that are the same, but there are also some differences, I guess, as well in the climate and the surrounding area. Could you maybe paint us a little bit of a picture of the region that you work in, please?
Yeah, thank you very much. We are working on Somali region, Ethiopia, dry area most of the time, and might not get adequate rainfall within the year. There are possibility that the rain is very limited to some localities, or might not be possible to get a rainfall. And due to the climate change, the situation gets worse and increases the vulnerability of people in the areas of chronic food insecurity and shortage of water. And within this connection, Ethiopia experienced the worst desert locust outbreak, which has exacerbated and food insecurity, high malnutrition, and other public health events, and increased the deterioration of agricultural production and livelihood means of rural pastoralist community. And within this climate change, there are a high level of inadequate of basic service like water, pasture of livestock, repeated disease outbreaks, and new emerging diseases, livestock production, irregular flooding, which is due to land fragmentation, erosion, and land degradation, which has a negative consequence on the community, the way they live, and has contributed to increasing conflict and climate in these IDPs. And sometimes you may see people who have dropped out from rural area and came to urban cities, and they don't have a skill that they can adopt the way the people who are living in urban cities they live. So they are getting more challenging, and the IDPs and the vulnerability increase due to this climate change situation. Actually, the coverage of water, which is the backbone of the life and the livelihood of Somali region, getting worse, and the coverage is almost 28 up to 30% in the urban cities, the availability of clean and safe water. And in the rural area, the coverage of clean water is 10 up to 15%, which is challenging, and the magnitude and the size of the need is very high. And imagine when the number of people getting is very short for clean water, the situation will always worsen for the livelihood of the community. So in our suggestion, we are working, we are getting only in 2 ways of water. We are getting either underground water, like deep wells, shallow well, and hand dug well, and also we are getting in a surface water, like river and rainwater. And sometimes in a locally made possibilities, communities living in a rural area, they do in a rainwater collection, what is called in a locally in a birka. So they are just using 1 up to 2 months, but at the end of the second month, people will suffer and they don't have access to get and clean, and even sometimes they may not get even the contaminated water that they have collected on the rainwater. Unfortunately, the available even boreholes is getting difficult and challenges because of the vastness of the area. The Somali region context is, and huge and especially populated communities with wide range coverage of land, and people are scattered on this land. And if the well is damaged, maybe the possibility to reach and quickly maintain for that borehole is too difficult. Maybe you can go away from 200, 300 kilometers away from borehole to the next borehole, which is too difficult. So regarding this, it's one of our major challenges. Maintenance issues of the borehole is also one of our challenges we are facing as usual. Fueling of the generators working for the borehole is also one of our challenging, particularly during the dry season, where the load and the need of water is very high. So in this connection, as a humanitarian aid worker working in Somali region, we are doing on ways we can improve our humanitarian response, supporting for the drilling of deep boreholes, and using renewable energy for solar system, because to avoid any maintenance costs, to avoid and fuel cost, and to avoid repeated damage of the borehole, we are developing with this using of renewable energy, solar, with the support of regional government. And we have successfully managed for the last 3 years to implement such projects in Somali region, but the need is very high, and it will be very helpful if these projects should be encouraged and expanded to the rest of East Africa and other regions which has similar topography. So thank you very much.
Thank you, Mohammed. Yeah, no, I think that's a really good point, because I mean, obviously we're looking at climate change is something that has many implications on sustainability and using different technologies, but also sustainability means that if something breaks, you have a mechanism in place that something can be fixed. I think internationally we're looking at, I think the numbers now are got 771 million who still lack even basic services, and I think the communities that you work in are fairly hard hit with that as well, or even more so than average, obviously, because they are so vulnerable that even slight changes in climate have a direct and tangible impact right then and there. Now, one of the other things that has been sort of following us around for the last 2 years, basically, is the global pandemic with COVID-19. Maybe since you're practitioners from the field, maybe starting with Amina, could you possibly give us a little bit of an insight on whether or not COVID has impacted on the way you've been able to implement the projects? Has it stopped you completely, or have there been ways that you've been able to sort of reprogram and react to the situation? Sorry, Amina, can you turn your microphone on, please, again?
COVID-19 pandemic has really challenged our implementation of activities, because we are working with the pastoral communities, and once we are able to support them in getting access to water through drilling of the borehole, construction of pond dam, we normally establish a management structure to be able to manage the system on behalf of the community. So it has been a challenge for us to be able to conduct the sensitization meeting, training, capacity building of the operators, and also establishing of those wash facilities has been a challenge because of the restriction of movement, because of the measures being taken as a result of COVID-19, the issue of social distancing, the issue of there is need to be able to sensitize more the community on COVID-19, which has really delayed most of our activities, especially wash activities. We have not been able to implement on time because of those restrictions and measures need to be taken to be able to take care of our community and also ourselves as staff.
Matt, you are muted.
Sorry, thank you very much, George. Right, it seems that we've lost Mahmoud from the feed, but hopefully he'll be able to join us again in a minute. So thank you very much, Amina. My microphone was muted, my apologies for that. Maybe George, if I could get you to give sort of your spin as an international organization working in the region on just the general access to water and maybe some of the health implications that has.
Okay, thank you very much, Matt. Now I will allude to some of the comments from my colleagues, especially the colleague from the Somali region, especially in terms of access to water, especially in the rural areas, where it talks about 10 to 15% access. And I recently visited some of the program sites, and in one of the remote areas where we work in as MDM, access to water is a major issue. Now, what we see this in terms of the health of the population, in terms of the health of the people and the children, is that we see regularly see in the facilities and in the clinics that we work with, we see water-related diseases. For example, we see some of the cases that our staff see in the facilities include diarrhea, include typhoid, and these are all related to the fact that these communities, especially in the rural areas where access is only 10 to 15%, may not be able to access enough water, for instance, to deal with personal hygiene. And so some of the health problems we see are basically related to to lack of personal hygiene because water is limited. When they access it, it's rationed. They prioritize, maybe the priority is cooking. They don't prioritize personal hygiene. The other thing, of course, is that we also see, and this is particularly we see with children that have recurrent diarrhea, and then this leads to, when they visit facilities, we also detect, for instance, that they have malnutrition. And so in the process of treating them, handling their malnutrition issues, dealing with the diarrhea, you can treat them. But then after they're discharged and they've gone home, then 2 weeks, 3 weeks down the line, they're back. So this, basically in terms of health of this child or of these children, you have these recurrent problems because the scarcity of water is perennial, it's chronic, and when they do have access it, then it's not safe most times, especially in the remote communities, especially where Mahamud talked about in the Somali region. So the exposure to children to chronic diarrhea because they can't not have water, chronic malnutrition also leads to to poor poor development in terms of their mental growth and their sensitivity to the environment and being able to grow, to be able to survive. So this in particular is we see a very clear link in terms of access to water to the health of children, particularly in the rural communities. I also wanted to look at the other thing, especially the emerging infectious diseases. My colleagues just talked about COVID-19, and we know, for instance, that infection prevention and control relies a lot on access to water, whether it is in the health facilities, whether it's in the rural and the slum communities. We do need access to water for us to be able to promote, for instance, routine hand washing as a good practice, to be able to deal with matters of controlling and being able to prevent infections. So the emergence of COVID-19 and other infectious diseases like Ebola in West Africa and DR Congo have put a lot of pressure on communities, on institutions to be able to have access to water, because that is the only way then we can promote routine hand washing, that we can be able to to increase the level of infection control around us, and in particular I would really focus on healthcare settings. For example, we have health workers that are at the front line, and they handle equipment, they handle commodities. They have to deal with to respond to and handle patients. Now, a requirement and one of the COVID pillars is IPC, which requires therefore that facilities and health staff have adequate hand washing structures, of course, with soap and other disinfectants. Now, we see a serious strain, especially in some of these rural areas where access to water is so difficult, and that the amount available is sparingly used. So then health workers are exposed, so that health facilities do not meet the kind of standards required, especially that is required for healthcare settings, to be able to make it safe for our health workers, to make it safe also for patients that are visiting, women, children. Because if these standards are not met, if the cleanliness in the facility, if we cannot disinfect it properly because we don't have water, then the exposure to infectious diseases remains relatively high, both to the health worker, but also to patients and individuals visiting health facilities or healthcare settings to seek care. You're muted again, Matt. Okay.
Can you hear me now? Okay.
Yeah, we can.
Sorry, I just got kicked out. I was frantically trying to get back in, but I had the live feed, so I heard most of what you said. So thank you very much for that.
Okay.
Also, welcome back, Mahmoud. You were out as well. I guess with online events like this, that can happen. So hopefully that didn't disrupt us too much. Before you left, Mahmoud, I was about to ask you on the COVID impacts on your programming. So maybe we can just sort of go back to that really quickly, so you can give us an update there.
Okay. Thank you very much. That was really good question. COVID-19 has impacted the overall lives and the livelihood of the community we are serving for, and has impacted the ongoing projects, particularly in Ethiopia as well as in Somali region. One of the key points, for example, was just the restriction of travel movement, because of the caseload was more common on Addis Ababa level, because of there were a lot of number of people deported from other countries, people like in Kenya, in Uganda, in Ethiopia, in Somalia. Overall, the people who were deported from there and people who were traveling, almost all were in Addis Ababa. And all this virus load was accommodated in Addis Ababa, and it was difficult to just move from Addis Ababa to field level because of the restriction. Variables was to limit the virus transmission from taking the more populated people to rural area where people is difficult to be managed because of they are living in a remote area which is difficult to serve. So one of the major points was restriction of movement. The other one was, the already ongoing project doesn't have a mindset of COVID-19, and the COVID-19 restricted about the health education programs. For example, there are continuous trainings and a provision of healthcare service. There were also sensitization meetings. There are also public gathering meetings that, transfer to the health message, because of we are more on focusing on the attitude change of the community to care themselves, because of getting the real message will help them for their life. So all this was difficult to be carried out, and just we think about just reprogramming, and number of activities were delayed, but lately we solved that program. But it has a great impact, because of at least for the first 3 months it was even difficult to come to the office, because of even offices were working on home based, the work. So it was just one limitation, and it was very important to overlook about the ongoing technical activities. For example, we are, the senior program coordinators at regional and national levels, and the only frontline health workers were not able to do all the works ongoing on the field level. So that also has limited to one of our, implementation area. Funding was also one of the big issues, because of projects, and the donors are almost based in developed countries, and the coronavirus has impacted more than in the developed countries, but particularly lately. Yes, it's affected a lot, but at the beginning, the developed countries, the donors there, even donors themselves has impacted about the COVID-19, and it was difficult to get additional fund that you can serve for the community, that you can provide hand washing, that you can provide water tracking for the isolation centers, and it was difficult to get even medical supply support normally even the overall restriction movement was a bit difficult, and the funding was also the same. So that was one of our major challenges, but the challenges cannot be just summarized here within this short time of period. So thank you very much.
Yes, thank you very much, Mahmoud. I think also that, sorry, George is now gone. Seems like we're taking turns and dropping out. But anyway, Mahmoud, I think it's really encouraging to hear that you were able to even though it was a bit limited to work through COVID-19 so far and keep activities going, because as a WASH agency, the hygiene part of it is something that uniquely qualifies you to also have dissemination of information that's so useful in this pandemic, about the social distancing and measures that had to be carried out. So I think it's very good that you were able to within limits still carry on the activities. That's also something that Ichunova as an organization and our partner organizations were really happy that we didn't have to sort of stop any project completely, but we were able to regroup and change activities slightly to sort of address the issue. Right, so now George is out. Let's hope that he's able to join us in a second again. But I would like to now move on, because we've talked a lot about the issues that we are facing as organizations in the implementation of our projects in the specific regions that you work in. Welcome back, George. Perfect. So what I would like to do is now sort of, because the situation is the same everywhere, but it is also uniquely different in the details of it. So, and having this forum here today gives us an opportunity to, for you from the field perspective, to highlight some of the innovations and adaptations that you might be doing at the moment. So, see, Amina, do you have something that you would like to highlight at this stage? Something that you're doing in Kenya that might also work somewhere else that could be adopted by others?
Yeah, thank you so much, Matt. As PASIDA, we have been supporting the community through drilling of boreholes. That is a permanent water point, so that they can be able to give them water they need for hygiene purposes and also for other purposes, for livestock use and domestic use. But there is a challenge with there is poor management of water resources, because both livestock and for human consumption, people pay for water, but you will not see that money collected, the revenue collected from the sale of water, as much as we have a management structure being elected by the community members to be able to run their system on their behalf. So because of that challenges, as an organization, we conducted an assessment to be able to see both socio-economical and technical assessment, to be able to see where is the challenges and come up with a way forward to be able to support and also build the resilience of the community. So through that, when we did an assessment, we found out that there are challenges in several areas, like financial management. There was challenge, management structure, resource management, technical relationships, and we were able to come forward, and one of our way forward is to be able to put up an innovative technology by the name prepaid water meter system. That is an automated device, a water dispensing device, automated, is put up at community water point to be able.
Okay, I think we've lost Amina now. I don't know how much of that the audience was able to hear. Let's give Amina a chance to come back in. Maybe I can just summarize a little bit that there was a system that they're using in Kenya, which is sort of an automated system that's based on the networks of mobile phones and so forth, so that they have ways of tracking water usage and maintenance and those kinds of things. So sort of having real-time data on water sources and those kinds of things make it quite a lot easier to ensure that the service delivery is constant and upheld. I think having been in the region for quite a while myself, I was very taken with some of the innovations that one can see in this sector, especially in Kenya, but also Ethiopia, where you have sort of the mobile phone as the basis for bank transactions or weather forecasts, and you have systems even before smartphones were active. The Kenyans were very early adopters for having SMS-based systems for dispersing information about when to plant crops and things like that. So there's some really neat things going on there. So I guess hopefully at some point, if you're watching this and you would like to find out more, then you can check out Amina's organization's website and get some more information there. And hopefully she'll be able to join us again. Mohammed, you're also gone, but you're back now. So I'll just pick on you if that's okay. Do you have some kind of an innovation or an adaptation that you're doing in Oda, in Chichika, or in the Somali region that you would like to highlight here?
Yes, thank you very much. We have a number of approaches, innovations, and in our implementation area. But one of the most important one I want to share the team is we have a project driven from the community called Community-Led Maternal and Newborn Health. And this project came up with our strong community engagement. We have done before the project more community engagement, providing a comprehensive social accountability programs, ownership, and community participation. But the good thing, community come up with good ideas, guidelines, and supporting with us, and come up the project they themselves lead, and will take just the overall designing, implementation, and even the sustainability. So with this project now we are under piloting in Somali region, particularly Dolo zone, which is almost 600 kilometers away from Jijiga. Almost so far is a very good and progressing well, because communities have already designed the project. They are themselves contributing the project. They took the ownership, and just they are doing a great job right now. And we are financing with the support of Women's Hope International, because the project is funded by Issues Development Corporation with the support of also Women's Hope International. It's a multi-funding in a project, but the main role taken by the community. But for example, ODA and Women's Hope International are just facilitating the fund, but the communities are the leading, implementing the project, and taking the overall leadership of that project. So we are now on the second year. The project is already a 3-year project, and we are the second year of the project period. We are planning to evaluate, at the end of the project, and I hope it will be in a very interesting point, engaging the communities and driving the projects from their mind and implementing them, because this will help the sustainability of the projects implemented by the organization together with the government as well as with the community. So this is one of the most important things I want to share with you. But there are other important points. If you allow me a time, I can just add one or two. Thank you.
Matt, you are muted.
Now, okay, it takes a moment. I've already unmuted the mic. Sorry. Good. Can you hear me now? Perfect. Right. Mahmoud, thank you very much. I think I'll keep that at the back of my mind in case we have some time in a little bit. There might be some questions from the audience as well, so that I would give preference to if that happens. But before we do that, George, could you give us your perspective as well on sort of maybe some of the bigger picture multi-sectoral views on some of the adaptations and innovations that are happening in the different projects and so forth, please.
Yeah, thank you, Matt. I think we all have problems with the internet. So one of the ways in which we are trying to adapt is to have a multi-sectoral approach to our engagement with the various communities, the various affected populations that we work with. And this is an approach that allows us to be able to have a more holistic engagement, basically a more robust and holistic engagement with the various communities that we work with. And what we do is instead of, for instance, just going for a health program as a standalone project or a nutrition program as a standalone project, but that we engage the communities in a more diverse way, and so that where we have a program, the program would look at health. The program is designed that it would include nutrition, it would possibly include WASH, but also, even though this could not be part of the program, but we would also, as part of the wider community engagement, also look at, for example, the situation of food security with the community. So this approach gives us an opportunity to holistically engage with the community, so that while we see women and children come to the health facilities, but we also able to know, for example, how much are they able to access water back home, because they are all linked. This is quite interlinked. So then the essence of the WASH program then would look at the access to water by the communities in the rural areas. At the same time, while a child might come to the facility only because they're malnourished, but then the facility should be able to also look at the clinical aspect of their problem. And because a lot of the engagement that we do with the communities, part of it go all the way to meeting with the communities in the very rural areas. So we also think that the multi-sectoral approach gives us an opportunity to discuss other issues beyond, for example, beyond the health problems they have. For example, when we have meetings with WASH committees or women groups, we also look at how they're handling their environment, and how they're conserving the environment. Quite often, for example, in the Somali region, a few times that we've gone to the field, we'll see people transporting chunks of charcoal. And charcoal, that means they have cut down trees, and that means they're already interfering with the environment around them. So these opportunities, during these discussions, we engage with the communities to be able to understand, for example, that cutting down trees is basically a threat to environment. So we use this opportunity to engage them, to tell them also that it's significant that if they cut down trees, then it makes sense that they also go on some kind of tree planting, and that they, that would help deal with some of the environmental issues. And because we know that there's some trees that are very efficient, for example, in absorbing carbon from the atmosphere. And so some of those trees would serve as conserving the environment, but also addressing in a small way, the climate change, the climate change aspect of our approach. So these are just some of the approaches that we are adopting, to be able to look at issues more holistically. And now that climate change is catching up with us really, really quickly, we look at some of those issues as well.
Thank you very much, George. Can you give me a thumbs up?
I can't hear you.
Okay. Is it getting any better now? I apologize for all the technical difficulties that we're having.
hello, Matt. Yeah, this is really very.
Hello, hello.
Yes. I mean, I think we have a problem with internet.
Yes, but I can continue. You know, even me, I had a problem with the internet, and then I stopped at some point while I was discussing about the prepaid meter system.
Yes.
With the prepaid meter system, it has really improved the revenue, and now the community are able to maintain and operate their system, take care of all other expenses in relation to wash facilities. And because of the improved revenue, the community members are now able also to expand their wash facilities and also be able to support other community development activities like bursaries. They have been supporting, giving bursaries to poor and needy students within the community. Due to improved revenue, they are able to support, especially at the peak of the drought, carry out food voucher, do cash transfer, and also water tracking for community who are living far away from the permanent water points. And in some areas, the community members are also able to support women group activities through giving them funding so that they can be able to improve their activities as women group. So with the improved system, now the community can be able now to stand on their own, unlike before where they have been relying on external support, seeking for support for something even as little as 5,000. But now, immediately there is maintenance issue. They just seek for any expertise, even if it's a private company, to be able to rectify the issue within the water supply system. Unlike before, where once the system breaks down, because they don't have revenue, they have to wait for long, between 1 month to 1 year, to be able to repair the borehole, to be able to repair other wash facilities within that community. And what that means is that the community will go back still to the other system of challenges of looking for water, traveling to the nearest other water points which are working, wasting a lot of their productive time looking for water. But with the improved system now, the community now even they are even using their ward allocation budgetary to be able to upscale the prepaid water system. Even for Pasida, we have been through WASH forums, we have been sharing with our partners to the innovative technology of prepared water system. And through that, other partners also have come on board to support the community to put up a prepared water system in most of the water points, especially the permanent water source. And for the issue of challenges with water quality, we have been able to put up a desalination plant for some few areas to be able to take care of the issue of salinity. But although we have tried now 3 sites, but the need is huge in terms of desalination of water to make water safe for the human consumption. The huge is still need. And as an organization, we believe in partnership, we believe in collaboration, and for all our activities we have managed to support community in terms of access to safe drinking water and also water for their livestock. We have partnered with other organizations, both local and international organizations, because we believe that as an organization, as PASIDA, we will not be able to support community only. We will not be able to achieve everything because of the huge need and ever-growing need. So when we believe that once every partner pool their little resources into one basket, they will be able to achieve more do an activity which will have more impact on the community. And in all our activities, that has been the case. You will have so many partners on board, one partner drilling borehole, another partner bringing desalination plant, another partner bringing on board prepared water meter system. And through that, we have been able to achieve more as an organization.
Okay, I hope you can hear me now.
Yes, we can hear
Wonderful.
you now.
Thank you so much, Amina. First of all, I'd really like to apologize for all the technical difficulties we've been having, but it's been shared fairly amongst the group, so hopefully you can forgive us for that. I have no idea why this was happening, but anyways, we'll just have to deal with it. We've got about 9 minutes left, and I would like to take some questions from the audience, if that's all right. Let's see. I just saw one. I'm scrolling slowly, so again, the internet is not playing with us. Okay, now I've lost the feed. And now for my chat is now completely blank. Does somebody else see the questions?
Yeah, I mean, are you able to see the question?
Yes, I'm able to see the question.
Yeah, there's a question there for Amina.
Yes. Can you read out the question first and then answer it, please?
Yeah, I'll read out the question. Amina, are there any geological examinations made before digging new boreholes, e.g., salinity, water table level, etc.? Are there national standards with regard to distance to pit latrines? That is the question for Amina.
Yeah, before we do the drilling of the borehole, we normally conduct an hydrological survey. We engage an expertise who can be able to survey the groundwater. And with that, we normally also do the hydrological survey. After the hydrological survey, that is when we are able to seek for funding from our partners, from donors, to enable us drill a borehole, and also seeking funding to be able to equip that borehole so that water will be able to reach the community. And with regard to distance to pit latrine from, let's say, a water point, the pit latrine should be for a distance of like 50 meters away from a water point.
Good. Thank you very much. I mean, I hope that answers the question from the audience member. I think I just want to make it very clear that, as humanitarian organizations, of course, we work within, the local engineering standards of the countries that we're working in. And, obviously with boreholes, from my experience, especially in sort of vulnerable island environments, you can actually do a lot of damage if you put boreholes in places where they shouldn't be, with salt water pushing up from the bottom, if you pump too much out and so forth, and you can mess up a water source for several years if you don't know what you're doing. So I think that's something that I'm very happy to hear that this is something that all of the organizations are aware of, and I'm just assuming that I actually haven't worked with ODA before, but I know that they do this themselves as well, that they get expertise in to make these decisions. And obviously in most countries you can't just start drilling a hole into the ground without getting permissions, and there's a lot of red tape. So anyway, that was a very good question. There's another question in the feed now that is basically going to everyone. And that is, how big is the area of intervention in Kenya or Ethiopia, and how many people are affected in that region? Let's see, I don't know if Amina has dropped out, but Mahmoud, would you like to answer for the work of ODA, please?
Yes, thank you very much. This is a very interesting point, for the point of, raised by are your organization recognized to international analysis? Yes, but it's not in such much strong. Since 2017, we have number of international alias meetings. Our organization participated, like World Summit conducted in Turkey. Another was Auda participated in a meeting conducted also Geneva in 2019 beginning, and this was just supported us from Oxfam International. So, but the engagement at the international platform participation is not strong, but still there are some meetings platforms who have already participated, but still the engagement is not so strong. So that's one of the point I want to raise. On the climate change, no, except from the within the country, but for international level, no, we didn't participate more on that. So thank you very much.
Thank you very much, Mahmoud. I think we're really coming towards the end now, and you've already asked the next question that was in the chat as well. So maybe just so we don't get cut off in the middle of someone's sentence, I think it's wonderful that we've had this opportunity for everyone to give their perspectives. I think looking into the future, this is very valuable, and I think we will have more international engagement, because the issues that you are facing in your communities on the ground are issues that other organizations like yourselves are also having in other parts of the world, and we can do a lot by finding best practice, benchmarking against what others are doing elsewhere, adapting it to the local context and learning from that. And I think that's something that discussions like today are going to do a big part in getting us to solve some of the bigger problems that we're having as a community on the entire globe on a micro level as well. I would like to really thank all of the panelists for being here today. Despite all of the technical issues, it's been a pleasure, and I hope that we were able to sort of give all of you the a fair balance of time to get your points across. And from my side, it was a pleasure to spend some time with you leading up to this, and also Mahmoud I've met in the past. So yeah, it's been a pleasure to have this event. Again, big thanks to the live translators for our colleagues in the Francophone parts of the world. And yeah, and now for the panel members, great to see Amina.